You know, if you think about where Governor Andrew Cuomo was in the public sphere about a year ago, there were a lot of people who were pushing him to run for president. There was concern that Joe Biden was stumbling out the gate, that the Democrats were losing an opportunity to win back the White House. And, his daily and extended briefings on COVID and the spike in cases in New York, and I was handling that, were sort of seen as a modern day FDR fire chats. FDR himself, of course, a former New York governor. That was then, this is now. He's out of there. He's going to be stepping down in 14 days. But the virus, ironically, for which he had gotten so much acclaim and notoriety, still sticks around New York. Serious spikes in cases that are leading a lot of companies to push back in-person returns to the office. Let's get the read on all of this from Dr. Bankole Johnson, the ADL Pharma Chief Medical Officer, neuroscientist. Doctor, thank you very much for taking the time. I do not want to draw you into political debates, nor should I. I think that would demean your fine brain, sir. But I do want to get your sense of these spikes that we're seeing, not only states like New York. I think there are 11 of them now by last count that have seen these serious spikes of at least 1 million cases. What's going on?
Well, first of all, thank you for having me on your show. And no topic is obviously off the deck as far as I'm concerned. But coming back to where we are, we're going to see these spikes because we have a large number of people who are unvaccinated. Only about half of the United States is currently vaccinated. So in pockets where there are unvaccinated people in large numbers, you're going to see tremendous spikes in terms of hospitalizations and, unfortunately, deaths. My concern is that if this is not brought under some significant control, we are likely to see the development of new viral strains, which might be even more lethal than the current Delta variant. We will see spread into children. We will see spread into all parts of society that have been relatively less affected. And we will see an increase in suffering, whether it be addiction, whether it be homelessness, mental illness, anxiety returning to work. Therefore, we really need to try and do all we can to prevent this coming next pandemic.
Do you think this is getting as worrisome as it is in Asia and China, where they're actually reimposing pretty severe restrictions, the likes of which we last saw in the height of the pandemic? Is anything like that possible here, Doctor?
Unfortunately, I think unless we change our ways and we adhere to proper mask mandates and get vaccinated, we are headed that way, unless we are somehow extremely lucky, because the data don't lie. And in fact, you can look at what has happened at countries that have relaxed too early, like Great Britain. And in fact, there was a tremendous spike in terms of illnesses, in terms of deaths. And that alarmed the government into coming back and increasing restrictions. Now these restrictions are off again. Travel is beginning to improve across the United States and abroad. All of that is going to spread the virus.
I got you, sir, and I'm jumping on you rudely because of all this breaking news, but I want to thank you for taking the time. Hopefully people will be able to get those vaccines, protect themselves and everyone around them. Doctor, thank you. By the way, we are monitoring Jen Psaki at the White House briefing right now, saying that the president's views on Andrew Cuomo remain the same. Nothing has changed, has not spoken to Governor Cuomo. You might recall early last week when the when the state attorney general's report had come out, that he had said the better part of valor would be for the governor to resign. And he has, effective in 14 days.
For review from his team.